The nation's vaccine rollout is about to go to the next level, with GPs to be paid to make home visits to the elderly and inject them in the comfort of their own living rooms. It comes as an entire Melbourne housing complex was put into lockdown after transmission of the virus in common areas of the block.
Melbourne lurching further out of reach for any of us hoping to visit for upcoming school holidays as nurses scramble to this inner-city housing complex.
Department of Health specialist nurses were on site this morning and a pop-up testing facility was established. 2
are infected. The first, a worker at the Arcare nursing home where the city's outbreak began. The second caught it from them.
Door knocking and testing is actually well underway.
With news of 2 new cases today, both children, at least older Australians, are better protected now as the national vaccine tally closes in on 6 million.
We now have 44% of those aged 50 and over having received at least 1 dose of vaccine.
It's good, but we want it to be better.
To that end, the government will pay GPs to make home visits, vaccinating the frail and elderly in their living rooms.
It's about expanding the vaccination program, bringing it to people.
The pandemic has brought an unexpected benefit. 2 winters ago, we had clocked 132,000 cases of the flu by now. This year, barely 300 thanks to social distancing, better hygiene practices and hotel quarantine.
July, August, September will probably be the times we see the most flu.
Long weekend business is booming in the Rocks, and to that extent we're very lucky in Australia that society remains so open. But there is an irony from the pandemic that it's not the lack of customers, it's the ability to serve them.
Backpackers are often the backbone of pub service. Foreign chefs too.
Between 140 and 250,000 less staff out there, and backpackers is a big part of it, and also those that are on 457 visas.
The staffing at the moment is the number one push point for all the hotels.
Also, the extra cost of ensuring a venue is COVID safe, a cost which is then passed on to us all at the till.